The most recent Minnesota numbers speak for themselves. More than half of the drug-related deaths in 2015 were attributed to prescription painkillers. Fast forward now to 2017, where officials continue to treat the problem. We've shown you plenty of stories about drug overdose deaths and how it's affecting us here locally, but tonight we show you a side you haven't seen, one where the addiction started in the operating room. It was no surprise to find him here on the mat competing and becoming a Minnesota wrestling state champion.
After that, I went on to college, went and wrestled at Ohio University Division I.
For privacy reasons, we're calling Joe by his first name only. At Ohio U, Joe didn't last long. He ended up coming back to Minnesota and to wrestle for RCTC, but like many athletes, he hurt his knee and needed surgery.
You know, it was like 6 weeks, I think, and I was prescribed some Percocets, and then after that, I had another shoulder surgery, and that one was pretty severe too. I tore my rotator cuff, and with that one I was prescribed even stronger medication. I was prescribed Percocet 30s, and it just took off from there.
He was hooked on painkillers that numbed life's pain, and when the medication ran out, he took a turn for the worse.
And from that, my addiction increased to smoking heroin and started buying it off the streets, and you know, my life kind of just went out of control with that.
Heroin was much cheaper, and he would get the same result. At 21 years old, twice, he would overdose and came close to dying, nearly becoming the next body in this morgue in downtown Rochester.
Unfortunately, more and more of our cases involve very extensive toxicology testing, and just the nature of that testing and process takes time.
Dr. Ross REICHARD is Mayo Clinic's chief medical examiner for the southern Minnesota region. He says his office is seeing more cases of drug overdose deaths.
A number of years ago now, for the first time, the number of accidental deaths in the United States from car accidents were superseded by accidental deaths from drug overdoses, and so it's a real public health issue.
Are actively addressing this issue.
And as the opioid epidemic continues to sweep through southeast Minnesota, the medical community is talking about the problem.
We're seeing patients come through our offices every day who have gotten hooked on these drugs.
Dr. SCHNEEKLOTH specializes in addictions of pain psychiatry. He says many patients like Joe shift from painkillers to heroin.
This is worse than the heroin epidemic in the past, the methamphetamine epidemic, cocaine or crack cocaine epidemic. So the numbers of people dying is huge.
It just gives you kind of an overview.
Dr. SCHNEEKLOTH was part of this community discussion where medical leaders talk not only about the social and financial costs, but also ways to tackle the problem.
So if you get the medical community talking about it, physicians, other healthcare providers will begin to monitor for this when patients are coming through, including primary care clinics for their appointments, directing people to addiction services to get help.
For athletes especially, man, it's just those prescription painkillers, you know, it's an everyday thing. It's crazy how many people are overdosing these days, but we still go back to it every day, you know. It's just got that strong of a pull on us.
Joe knows firsthand. He recently lost a good friend who overdosed on heroin. His funeral the day after this interview.
And it's just something that you're doing every day. I think it's the daily intake of it. You know, you begin to build a tolerance to it, and if somebody's not watching you or helping you take the medication, like me, you know, I was 21 years old at the time. You know, I didn't feel like I needed somebody helping me take the medication. And
now, years later, he's getting help, recovering at Minnesota Adult and Teen Challenge in Rochester. He hopes by sharing his story, it could help another person out there suffering.
I mean, I'm young still. I'm 23 years old, so it's kind of insane to me that at 21, 22, I was overdosing on drugs. You know, I'm 23 now, and I'm happy again.